Greetings, Program Director and the staff of the department gathered today. I'm unfortunately unable to join you today, but I would have loved to be with you to commemorate the World AIDS Day and the awareness that we need to create around issues of gender-based violence. Especially that we are commemorating this under the theme of equalize, integrate to end AIDS. I'd like to probably just as a way of background remind ourselves of the exposures that we've had as a department around issues of AIDS and HIV, STIs and also TB. It has been one of the things that have been having a long history in the department where we lost scores of employees and our community members in general. At that time, obviously, the government did not have a huge arsenal in terms of the antiretroviral treatment which was available, but we did remain hopeful and as a country that those who were infected were at least able to access some treatment at some point. And obviously with that, in the absence of the physical treatment, we then strengthened our psycho-social support as the department to create more awareness of positive living, because the mind and the soul are the cornerstones of healing from anything that causes physical and psychological discomfort. The department has made significant strides over the years by advancing the safe and conducive work environment for both infected and affected employees through our employee health and wellness program. We are particularly proud of what this team has been able to unleash in supporting our employees, and you must join me in really accolading them for sterling work which they've been performing in the department. The employees are able to consult with the employee wellness program practitioners who have been schooled on principles which are fundamental, being privacy, confidentiality, and respect for individual values. The department has an ongoing partnership with the GEMS, which is a medical aid scheme for government, who then are able to provide wellness screening services, which includes HIV counseling, testing, and the non-communicable disease such as TB, the diabetes, and hypertension. I encourage the use of these services when they are held in your respective offices. They are a springboard for you to start evaluating what lifestyle changes you need to make as a form of prevention, curative, or maintenance of good health choices. In the department, our status in terms of HIV and AIDS, we are currently standing at just about 395 employees who are on disease management program and taking chronic medication through our GEMS disease management program. This number has remained stable for the past 2 years, which hypothetically suggests that there has been no new infections in the department. In the current quarter, we have created access to quality health care for employees at salary levels 1 to 5 through the Tanzanite One option, which is 100% subsidized by government, especially if you are going to be enrolling a maximum of 4 beneficiaries. Almost 25 employees will start to use for the first time their medical aid benefits in March 2023. I am also mindful of the fact that the departmental recruitment drive is to bring on board young people who are at the childbearing age, who also aspire to start a life of their own through intimate relationships, which some may be match-made within this department. I therefore encourage you to be ready for that life stage by first getting tested and knowing your HIV status. But whatever is the outcome, you still have the responsibility to practice safe sex by doubling up through reliable protection or protective strategies. There is also pre-exposure prophylaxis treatment, which is normally abbreviated as PrEP, that is available in clinics for those who are HIV negative and who want to try to fall pregnant. The medication has a strength of potency which has been proven to prevent the transmission of the virus from your partner, if administered obviously correctly. Government has come up with the strategies. There is a strategy called the Triple 90 strategy, and we can see that our employees have been practicing this strategy, and it encourages that 90% of people, they know their HIV status, 90% must be able to take their treatment, and 90% must remain within the suppressed viral load levels. The strategy has since been amended to a Triple 95 strategy, but still remains an important strategy for government and the community and the society at large in terms of the fight against the HIV. And in that, if we're able to implement it accordingly, we should be able to equalize and integrate to really end AIDS as per the theme of this year. I want to also take the opportunity and extend my gratitude to those employees who have made an honorable commitment to the practice of self-care. The department is seeing a positive effect because of you and your way of handling your health status. Staying healthy and being dedicated, responsive, and productive has really ensured that as a department we're able to discharge our mandate with ease. I think I would have failed in my mandate if I do not address the issues of gender-based violence that are bedeviling our society, including our own department. The theme for gender-based violence this year says end femicide. Femicide being obviously the deliberate killing of women, a scourge that the government is working hard to try and make sure that we erase it in our society. Largely, government is advocating for safety of women and communities in general, and also those who are victims may also be DART employees. Sexual gender-based violence is synonymous with HIV transmission. Why I'm saying this is because there are current circulating media advisories and cases in court where an employee of one of the State Department was aware of their status, that they were positive as long back as in 2007 October, but still continued to engage in a romantic relationship with another fellow employee for that same State Department in 2016. The other state employee had tested negative before they entered into this romantic relationship. And as they continue with their relationship, few months down the line, the employee went for a test again, and the test came positive. And as a result, that employee sued his partner for murder, as it were. I therefore want to encourage all of us that it is prudent to openly speak about incidences of gender-based violence, especially at the workplace, which occurs in the form of bullying or sexual harassment. Gender-based violence can occur between men themselves or between women themselves, or as traditionally known, between men and women, or vice versa. I have been made aware of an unfortunate situation or occurrences within the department where employees were interns, in-service training, internship contract workers are victims of this unfortunate scourge, which is sexual harassment and emotional blackmail in the premises of the organization. I am particularly concerned about this trend, And I think we should look at ourselves in the mirror and really try and get ourselves to the values that are important for humanity in general. I therefore want to put up a clear departmental position that acts of bullying, sexual harassment have no place in this department or in the organization in its entirety, because it compromises the psychological safety of our employees who are doing an honorable service for the state and for our people in general who are in desperate need of these services. We would have failed as a department or as an organization if we do not ask our employees to desist from engagements of which are embarrassing our own department and our own organization. In that, I do want to encourage all of us to rally behind the theme of equalizing, integrating to end AIDS. I thank you.